people that are allied health professionals, that are social workers, psychologists, and so forth. And so it's a very important school to know about, been around for a long time. I specialized in psychiatry. I got my training at the University of Kansas School of Medicine in Wichita in 2010, and then became board certified with the American Board of Psychiatry and Neurology in 2012. And I currently see patients online. I did see patients face to face for years, more than 10 years, but I just, after COVID and everything, being online seemed kind of good for me, and I might change it later, but right now I'm seeing patients online, and I also supervise nurse practitioners and a physician assistant. So on the agenda is the following. What is a psychiatrist? What is psychiatry? What do psychiatrists do? And when should you see a psychiatrist? And then other resources about mental health, because a lot of people, from talking to different people, don't understand the resources out there for mental health. So what is a psychiatrist? A psychiatrist is an individual who has a Doctor of Medicine degree or a Doctor of Osteopathic Medicine degree from a traditional medical school or an osteopathic medical school, respectively. So you may see your doctor's name, it says MD or DO. It's still, we're learning about the same things. DOs learn a little bit more of the physical, hands-on things to do in the office, but we're both doctors of medicine. And then we both have to actually do extra training outside of that to specialize in psychiatry. So what is psychiatry? So I went to the Merriam-Webster's dictionary, and they are very, they pretty much got it. I have another definition after this, but the Merriam-Webster's dictionary said that psychiatry is a specialty of medicine that addresses mental, emotional, and behavioral disorders. So the American Psychiatric Association has a similar definition to that. They only see you for an hour, and they say they know exactly what's going on with you. I don't believe it. I'm just telling you. That's my bias, because I always want more time, and I always try to get more time and more information. So what they do is a screening. They try to rule out the worst type of illnesses, or the things that really need to be intervened on immediately, like major depression, bipolar disorder, schizophrenia, things like that, substance use. But there's still so many other diagnoses that can be missed in that little hour that they give you to do an evaluation. So we do the evaluation. We do prescribe medications. Sometimes, like in a diagnosis of major depression, like a mild major depression, you don't necessarily need an antidepressant, but the more severe your depression becomes, you would need medication. So I might as well say that now, because some people take depression lightly, and what they don't understand is depression can actually cause the shrinkage of your brain, especially the part of the brain that learns new things, which is the hippocampus. And if you don't want to be able to learn and think and memorize things, then don't treat your depression. But if you do want to continue to grow and to learn and use your brain capacity, please treat your depression, and please use an antidepressant if it's indicated. So medications are some of the things we do. We do treat substance use disorders. Sometimes that requires medication as well. We do psychotherapy. Now, psychiatry started with psychoanalysis, which was psychotherapy that was done multiple times a week and for many weeks. But then we learned more about science, and there's a biological aspect of psychiatry. We know how the brain works, the neurotransmitters, receptors, and that's where our medicines touch to help to improve the mental, emotional, and behavioral disorders of people. And so we kind of focus more on the medical part. Some of us are highly trained in the therapy, but what insurance companies want to pay us for is really the medical management. And I'm going to talk about the other professions that do the therapy. So I like this quote. It's from the book Paradise Lost. It says, "The mind is its own place, and in itself can make a heaven of hell, a hell of heaven." The reason I like this quote is it reminds me of cognitive behavioral therapy, which is one of the many therapies that are used to treat mental, emotional, and behavioral disorders. And in cognitive behavioral therapy, they identify the thoughts that can create and perpetuate mental disorders such as depression and anxiety. There are certain thoughts that we have that we entertain and that we repeat in our own minds that keep us sick. And this is an important quote because it is up to us whether or not we're going to make this present, this life that we live in, hell or heaven, and it's based on our perspective and our thoughts. So going on to what more psychiatrists do. We're physicians, we do order labs, we do order imaging like CT scans, MRIs, and so forth, because we're looking at the brain. Is this really just a psychiatric problem, or could there be a neurological problem, a physical problem that is causing this person's mental, emotional, or behavioral illness? We also do psychological testing, meaning, or we'll order it, because when I went to medical school, first of all, I didn't think I was going to become a psychiatrist, and I definitely didn't know the difference between a psychiatrist and a psychologist. So we do have a clinical psychologist that goes to this church, and clinical psychologists do a number of things, including therapy, but they also will do psychological testing. These tests have been proven to pinpoint diagnoses so that we know for sure this is more than likely what the diagnosis is. So we might order that the person sees a psychologist and gets psychological testing so we know for sure they have the diagnosis that we're working with. That includes IQ testing, personality disorders, and other psychiatric disorders. We might order somatic treatments. A lot of you have heard about ECT. And in the movies, ECT is portrayed in a negative way. You see the whole body convulsing, and that is not how it's done. We only leave part of the body to move during the stimulation of the brain, which does cause a seizure in the brain. But what it's doing is it's kind of resetting the brain so that the chemicals that need to be released to help someone feel better can be released. There's TMS, transcranial magnetic stimulation. It stimulates a specific part of the brain to help improve people that are resistant to just regular medicines for depression, and it treats other things. We make referrals to other medical providers because once again, we are medical doctors, and we recognize that this is not just a mental health behavioral issue. This is something that has to do with a physical problem, like diabetes. This person has unstable blood sugar, and when their blood sugar gets too low, they act erratic. This is not a psychiatric problem. Things like that. If you have a hyperthyroidism, you look like you're bipolar, but you're not. It's really that your thyroid level is too high. We do referrals. So when should you see a psychiatrist? You should see a psychiatrist when you have a mental, emotional, or behavioral or substance use issue that negatively impacts your life. We just have very rich lives. It's not just, it's not just in one area. It's the social area, the work, your school, your family, just other things, your mental, your interpersonal life. When all of these things are being impacted by your mentally, emotionally, behaviorally, or by a substance, this is when to see a psychiatrist. Other reasons to see a psychiatrist is when these mental, emotional, behavioral, or substance use issues are beyond your control. A lot of us try to deal with depressive symptoms on our own, which I said, when you let depression go for a long time, you are causing your brain to shrink, and it actually does increase the risk of Alzheimer's disease, and you can go and look that up, but that's what it does. Depression should be treated, especially when it's more than a mild depression, and I repeat that so that people won't let it go, because depression and anxiety is definitely common in American society. You go to a psychiatrist when your condition, your mental, emotional, behavioral, or substance use issue is beyond the specialty of a regular doctor. The regular doctors, meaning the family practice doctors, the internal medicine doctors, they do a wide range of things. But when if mental health is not their specialty, please see a mental health specialist. We do have paraprofessionals, which include physician's assistants who were trained to assist physicians and do the diagnosis and medicine, but they didn't train as long as a doctor. A nurse practitioner didn't train as long as a doctor. They didn't, we have to do not only 4 years of medical school, we did 4 years of additional training only in psychiatry. So sometimes the psychiatrist might know more in the area, and so you might need someone that specializes in mental health to do the evaluation and the treatment. If you have thoughts of hurting yourself or others, that is definitely another time to see a psychiatrist. This could be in an emergency room. This could be in a mental health facility, but you should see a psychiatrist for that. This is a very important slide. I want you to all take this in. A lot of people don't know about it. I believe they announced this in 2023, but it wasn't a very good, revelation I'll say campaign. It wasn't a very good campaign by putting this out there. This number has always existed, but not as 988. It was a 1-800 number. And it was for suicide prevention, but it's not only suicide prevention, it's when someone's having a mental health crisis. They were doing poorly. They were doing well, they were hanging in there, they were going to work and everything, but all of a sudden things got worse and they needed extra help. They just didn't know where to go. 988 is 24/7, just like 911. 911 is for, the fire and the police and everything. 988 is for mental health emergencies and not just for suicidal ideation. So we have other people that can do mental health evaluations and treatments. That includes nurse practitioners, that includes physician's assistants, and that includes family practice doctors, internal medicine doctors, and pediatricians. Because pediatricians are doing a lot of psychiatric work. They're doing a lot of the treatment for ADHD for our children. Once again, psychiatry started out with only just therapy, psychoanalysis specifically, but now we're doing more of the biological. We are doing the medical diagnosis and so forth, and that's pretty much what most of us are being paid for by the insurance companies. So we need other professionals to help us for mental health care for our patients, to do the therapy. So these are the people that are doing the therapy 24/7, meaning more than what we do. So I wouldn't say that I was as skilled as these people in doing psychotherapy. So please know who these people are: the licensed counselors, the psychologists, social workers, marriage and family therapists, because sometimes some of the mental, emotional, behavioral problems can be dealt with therapy. But also there's some people that have substance use issues, and there are outpatient chemical dependence treatment facilities. There are inpatient, meaning people are hospitalized or they stay in a facility overnight every day for about 30 days to do treatment. They help with chemical dependence treatment, and sometimes there'll be a psychiatrist because someone can have dual diagnosis. They can have a mental health problem plus a substance abuse problem, and they'll see a psychiatrist as well. There are licensed chemical dependency counselors. These people specifically give counseling to people that have chemical dependence issues. There are peer support groups like Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, and so forth. So I just wanted everyone to know the many resources out there for mental health. So next week, I guess I'll be answering some questions that you might have about this presentation, but the whole purpose of bringing up this presentation is for everybody to understand mental health, how it is treated, all the resources out there. And I encourage everybody to go and seek mental health treatment if you feel that you need it. Remember, it is God that provided knowledge. It is God who increased knowledge. It is God who made us and who has given us skills and the education and the knowledge to help improve health. So I just encourage people not to hesitate to take care of something that needs to be taken care of, such as if you had high blood sugar, you wouldn't hesitate to go see an endocrinologist to get your diabetes taken care of, because if you did, you might end up in a coma. So I encourage you, if you have a mental health condition, please take care of it so that you can take care of yourself, your family, and your community. Thank you.